Afternoon. I'll be talking on safety and efficacy of correction of myopic astigmatism with clear lenticule extraction. And clear is a new system of lenticule extraction, um, and the machine is manufactured by Zimmer of Switzerland, and I have no financial interest. And this is the video I want to show before we proceed further. So this is a normal lenticule extraction video. The beauty is that the pupil and the axis at 180 degrees is captured automatically. So this is the beauty of this system. If you mark at the limbus, it is even better. But if you do not mark, even then 180 degrees is reasonably well, acquired or captured. The posterior plane is dissected with the femtosecond laser, and then the anterior plane will be dissected. And if you go and see these two tunnels, here the arrow is not moving, but you can see those two tunnels at the top, the green and the blue, and they are the venting tunnels, so that there is no air bubble, going behind or anterior to the lenticule and having any difficulty. Regarding this separation, which you can see, I have separated both the anterior and the posterior, and once you separate the posterior, you can see the edge of the lenticule very well. So the definition of the anterior and posterior plane is not very difficult if you are doing a smile or a clear or whatever elita. So, and then you dissect it till the periphery, and once you have dissected till the periphery, if you have dissected completely till the periphery, then probably just a little bit of elevation in the spatula and then moving the spatula circularly, it will bring the lenticule out itself. So there is no need to pull the lenticule, and there is no possibility, any such tear or anything. But in here, this is the very old, almost 2 years back I did, and this is the lenticule which has come out, just to check whether it is a complete lenticule or not. So this study is probably the first study which shows the correction of astigmatism of up to 4.5 diopters by a lenticule method, which is very accurately possible with the clear system. And the topic will be like population and vision distribution, and total study population 50 eyes of 26 patients before surgery and after surgery, and how much vision was there prior to the correction. So in the pre-op refractive error, the spherical power was 0.75 to 7.25, and cylindrical was minus 1.5 to 3.5, and there were three groups: the mild, moderate, and high astigmatism, and mild, moderate, and high refractive error. And in all these cases, we have analyzed that even in the higher astigmatisms, the correction was very nice. So this is what the data is. The post-op 1 week data shows 82% of the patients gaining a 20/20 vision in 1 week time, and then it is 1 month is 84%, and 3 months at 83% with 20/25 in 10% and 20/30 in 7%, and all these patients who were 20/30, few patients gained one line after that. Also, if we analyze RMS values, they improved in 93% in at 3 months, and average reduction is 16.4 units, and clear demonstrated surgical efficacy in reducing RMS values. Higher order aberration analysis with the 6 millimeter pupil, preoperative mean HOA was a 1.87. It improved in 30% and remained stable for 3 months. Increase in HOA was found in 27% of the eyes, which reduced to 22% at 1 month and remained stable thereafter. So what I want to say is a clear is a procedure which is very accurate in correction of the astigmatism as well as the correction of the refractive error of myopia, and also the vision is stable for long time forever after 3 months. This is a 3 month study. We are further studying the data at 6 months and 1 year. The beauty of the machine is that it captures the 180-degree axis and then you can mark accordingly. So there is no need to, like in the the iris pattern capture in the excimer laser, this machine captures the axis at 180-degree very nicely, and that is why the astigmatism correction is, in other machines, the axis correction or astigmatic correction is not so accurate, especially in other machines where the capture has to be done manually and one has to rotate the cup manually. But here this is automatically captured. That is why this is a better system in all the femtosecond laser lenticule extraction systems. Thank you very much.
Very innovative, sir, and I think it's very, very promising. Does it really have, a priority in a particular machine, or is it a software which can be incorporated in the other machines as well?
I'm not sure about other machines because this is a software which is there inbuilt in the machine. It's not something which I don't know about this because the whole thing is different. All other machines are not so fast, and also the pupil capture is also not automatic in any machine. So the centration, especially if you mark the pupil and then you can mark the visual axis with the junction violet before, and if you mark the visual axis also, then it captures the visual axis, and lenticule centration is on the visual axis. So pupil centration, visual axis centration, axis marking is very accurate in all these
So what was the maximum cylinder, sir?
I have done 4.5 cylinder in this machine myself, and with a excellent result. In fact, that particular patient gained 1 line.
And since it is 180 pic, so in oblique astigmatism, does it have the same efficacy? I mean, the way you said
See, you have to mark the axis, and then automatically the lenticule is created according to the axis, whether it is oblique or horizontal or whatever. So it doesn't matter. Once you have marked the axis correctly, then oblique astigmatism is as well corrected. There is no problem on that.
So the numbers in your series, the high astigmatism was very less.
Actually, the number of high astigmatism patients is otherwise also low.
Yes.
Very few patients are having anything astigmatism more than 2.5. Majority of them are in the range of 1.5 to 2.5. So I think very few numbers. Of course, high astigmatism is and there are other limiting factors. When there is high astigmatism, the pachymetry and other things we have to be very careful about, because ultimately you are making the cornea thin. So we have to take accordingly.